Hello, everyone. Good morning, good afternoon, and good evening to all conference participants who are tuning in from wherever in the world you may be. My name is Michael Gallo, and I'm a research assistant at the United Nations University Institute in Macau. And today I'll be presenting on behalf of myself and my collaborators, Dr. Renata Konrad, who is an associate professor at WPI in the United States, and Dr. Thinyane, who's a principal research fellow also at UNU Macau. Our submission number is 32, and our work is entitled Applying Epidemiological Thinking to Assess Anti-Trafficking Interventions in the Thai Garment Industry. And so the topic of conversation for today is one of the most widespread and complicated human rights violations that occurs around the world today, modern slavery. According to the International Labor Organization, on any given day in 2016, there were an estimated 40 million people who were trapped in situations of modern slavery around the world. And this form of extreme exploitation can manifest itself in many different forms, and no country, geographic region, or sector of the global supply chains that make up our interconnected world is spared from the adverse impacts of modern slavery. And because of this, the eradication of modern slavery, human trafficking, and child labor in all forms has been enshrined in the Sustainable Development Goals and the 2030 Agenda, particularly under Target 8.7. And modern slavery is this overarching umbrella term that's used to describe a wide range of exploitative practices that can be further subcategorized depending on the way that they manifest. So much research that's been done in this area has focused predominantly on sex trafficking and the commercial sexual exploitation of children and adults. However, this has been to the neglect of studying other forms of exploitation, and within our research, we strategically focus on forced labor exploitation within the private sector of the economy. And we understand labor exploitation to occur along a continuum. So on one end of the spectrum, you have decent work, which is forms of employment that are not harmful to an individual and are compliant with international labor standards. And then on the other end, you have situations of forced labor that include serious harms to the individual and many human rights violations. And so we understand human trafficking then to be a series of exploitative acts that moves a worker from one end of the spectrum, decent work, towards forced labor through various criminal and labor law violations. So this is the way that we conceptualize and contextualize human trafficking and labor exploitation. And when researching human trafficking, there's a multitude of challenges faced related to data. So because of the criminal nature of exploitation, victims are often hidden because they're exploited in geographically remote locations, or because of the coercive power dynamic that a trafficker exerts over their victims, victims may not be willing to self-identify to relevant frontline responders or NGOs because of fear of retaliation either against themselves or against their loved ones. So you're dealing with an inherently hidden population that's hard to collect data on. Moreover, within the field at large, there's generally a lack of quantitative research and evidence-based or analytical evaluations of anti-trafficking programs. Most of the published literature relies on qualitative methods or exploratory case studies of how trafficking occurs in various contexts. And the data that is available and generated and put out there for the public to use is generally very fragmented because it's collected by different actors for different purposes. So for example, immigration officials that are collecting information on border crossings will be looking at data points that are different than law enforcement officers who are assisting victims or prosecuting traffickers, and they will be collecting different data than NGOs who are on the ground providing rehabilitative services to victims. So each of these different actors, although they are all part of the entirety of the human trafficking, understanding the entirety of the human trafficking process, they have different mandates about what types of data to collect, what they are to do with that data, and who they're able to share that data with. So that leads to the greatest challenge of researchers in human trafficking, which is how do you translate this oftentimes very complex social and administrative data into any type of actionable information and policy recommendations for relevant stakeholders? And in spite of these challenges, efforts to improve have been occurring over the past few years, such as the launch of the Counter Data Trafficking Collaborative, which has now become the world's first and only global data hub on human trafficking. So as data collection processes and standardization generally improves over time, it's likely that the application of new quantitative methodologies will be able to garner new insights that previously hadn't been considered because of either a lack of quality of data or an availability of data. And so human trafficking is also strongly associated with health harms that can manifest in a multifaceted range of physical, psychological abuses, sexual assault, exposure to occupational workplace hazards. And as I mentioned before, the ILO estimates that there's 40 million people worldwide that are trapped in situations of modern slavery. And it's very likely that an overwhelming majority of them will experience some form of adverse health impact, either directly or indirectly related to their victimization. So this makes human trafficking a public health issue of global concern. To draw a point of comparison, in 2018, the World Health Organization estimated that there were 38 million people worldwide living with HIV/AIDS. So roughly parallel in terms of the size and scope when we're talking about a public health issue that truly affects people worldwide. And because of this, it's led academic researchers, policymakers, and the popular media to frequently describe human trafficking as having reached epidemic proportions. And because at its core, public health is interested in the prevention of disease and mitigating the harmful effects of negative health conditions, and human trafficking can be thought of as an epidemic, perhaps the science of studying infectious disease epidemics has utility in generating new insights on human trafficking research. And so the science of public health that investigates disease causation, patterns, and trends is known as epidemiology. And it specifically adopts evidence-based approaches and uses quantitative methodologies such as probability, inferential statistics, network analysis to understand how diseases originate, how they spread, and how they can be prevented. And epidemiology, situated within the field of public health, are particularly well suited for interdisciplinary application because public health takes a very holistic view of its understanding of disease by looking at factors that go beyond simply biological, but also include economic, political, and social. So some human trafficking researchers have caught on to this interoperability of epidemiological methodologies and have used quantitative approaches that are typically employed in the study of infectious disease to be able to estimate the incidence and prevalence of human trafficking in various contexts. And epidemiology is, of course, a topic of great interest to everyone around the world right now as we're living in the midst of a global pandemic. And if you've been wondering, how are public health researchers taking the data that's becoming available and making predictions about the spread and mitigation of COVID-19, translating that data into recommendations for policymakers, the way that they're doing it is through epidemiological modeling. And in its foundation, this type of approach starts off by dividing populations into compartments based upon the natural progression of disease. So these include susceptible, exposed, infectious, and recovered, SEIR. And derivations of this also include SIR, susceptible, infectious, recovered, susceptible, infectious, susceptible, susceptible, infectious, quarantined. There's many different permutations of this foundational approach that can be modified and adapted depending on the dynamics of the disease in question, and also what types of policy questions researchers are hoping to answer through a modeling approach. And without getting into any super technical explanation of the underlying mathematics, these types of models use sets of differential equations to model the rate of change from populations moving from one compartment to the next. So the coefficients there that are highlighted in the red boxes represent the rate of change for individuals moving from susceptible to exposed, exposed to infectious, and infectious to recovered. And so you're able to add another layer of complexity to this type of modeling and make predictive effects about control mechanisms and preventative interventions and what impact they would have on the rate of change between these compartments and what impact it would have on the number of people within each compartment. So when people have been talking recently about flattening the curve, they're referring to the predictions within these type of models that interventions such as social distancing or travel restrictions or the wearing of masks would have on the overall spread and the rate of the spread of COVID-19. So this type of modeling approach makes up, in essence, the foundation of informed public health decision-making and has been used by researchers, practitioners, and policymakers to create effective strategies and solutions for well over the last century. And because epidemiology is particularly well suited for interdisciplinary application, people can think about when you're modeling an infectious disease, although you're considering the context of a virus in a biomedical framework, what you're also in essence modeling is the dynamics of a human population as you analyze how a virus spreads from person to person and across geography to geography. So researchers have adapted this SEIR model to study a wide variety of social and behavioral phenomena because at its core, epi-modeling is looking at the dynamics of how a human population interacts. And so instead of measuring an infectious disease, you use the same underlying mathematics and theoretical principles, but you're measuring an outcome, which can be defined along a number of ways depending on what you're studying. So for example, it's been used in a number of ways in a very wide and very interesting literature base to analyze things such as domestic violence, heroin addiction, gun ownership, the spread of racism, crime, things of that nature. So it's a very versatile approach that's been previously explored. And so this leads us to our ultimate question within our research is, can we model labor trafficking as an epidemic using this similar type of approach that's been previously employed in the study of complex phenomena outside of infectious disease? And this has potential to make innovative use of already existing data on human trafficking, as well as you can see the relationship between mathematical modeling and public health practice, that it's very cyclical in nature. So a preliminary attempt would be able to inform future data collection to create a more rigorous model, which then can be, through an iterative process, improved. And eventually, this is how we reach a level of modeling complexity and rigor that's able to provide insights, actionable information to policymakers in order to affect their strategic allocation of resources related to design, intervention, and program evaluation. So as we're working through this model development process of can we model human trafficking using this SEIR EPI approach, we have to first develop a knowledge base of what's the intersection between human trafficking and epidemiology. How would an epidemiologist approach this type of problem? Then we need a conceptual model that in turn informs our mathematical model of how do we subdivide the populations of interest in order to model these rates of change and simulate the impact of control interventions. So then the simulation can be populated with data from various sources, tested, validated, and updated accordingly, with the overarching aim that such a model could be implemented on the ground and through an iterative process of analysis, design, and evaluation, eventually create this feedback loop between policymakers and practitioners to deliver actionable information in the changing circumstances of operationalization of programs and allocation of resources. So to develop this knowledge base, if we put ourselves in the shoes of an epidemiologist, one of the first ways that they begin to characterize the dynamics of an infectious disease is by looking at what's known as the epidemiological triad, which organizes the various components that are of interest to understanding the system-wide dynamics of how an infectious disease spreads. So the host would be any individual or population subgroup that's susceptible to the disease in question, particularly those who are most susceptible, such as the immunocompromised or the elderly. The environment would be the set of geographic or locational factors that influence the susceptibility of individuals to disease, such as living in a subtropical climate. And the agent would actually be the virus, bacteria, or parasite that becomes internalized in a susceptible host, leading to the negative pathophysiology. And in this case, we're looking at Zika virus, for an example. And the last component, the vector, is of particular interest. In this case, the vector is a mosquito, because vector-borne illnesses take into account this other component that provides this bridge of interconnection between host, environment, and agent, which is very important in understanding how the system operates and where to design intervention efforts to interrupt the transmission. So we've drawn a conceptual parallel to organize our thoughts accordingly of what are the dynamics of what influences the occurrence of labor trafficking. So a host, once again, is someone who's susceptible to the condition, in this case being trafficked. And it would be an individual that's vulnerable along socio-demographically defined lines, like someone of an ethnic minority, stateless individuals, people who are living in poverty, fleeing conflict, or economic migrants. So the environmental factors would be those that influence people's decision to either voluntarily or involuntarily migrate within their own country or internationally, potentially exposing them to the risk of human trafficking. And these factors can be things such as climate change, economic opportunity, geopolitical shifts, or conflict. So then the agent would be what's actually causing the harm when it's imposed upon individuals. And we've defined this as the structural violence that society imposes on vulnerable populations in the context of the private sector of the economy. So this could include extortionate labor practices, governance structures that favor businesses over employees, manifestations of racism and inequality in the workplace, and in essence, anything that is interwoven into the political and economic organization of our society that has potentially negative effects on vulnerable people. And then the vector would be the component that brings together all of these others and actually causes the interconnection that results in the condition. So in the case of trafficking, this would be the recruiters, labor brokers, or criminal organizations that actually facilitate the act of human trafficking. So this is how we first approach the problem, thinking through an epidemiological lens. Next, we need a conceptual model that can effectively subdivide populations accordingly in order to inform data collection, which then feeds into the mathematical model. So some of the top experts in human trafficking have developed a conceptual model to describe the stages of the human trafficking process. And if you remember, the SEIR approach, susceptible, exposed, infectious, recovered, describes the natural progression of disease. So a conceptual parallel would have to describe the natural progression of human trafficking. So these stages are organized into recruitment, travel transit, exploitation, and integration or reintegration. And recruitment is where an individual is first susceptible to the deceitful practices that can lure them into a situation that eventually becomes human trafficking. Travel transit is when they're first exposed to more serious forms of risk, such as dangerous border crossings or willfully violating immigration policy in either a source or destination country. Then the next stage would be exploitation, which is when the actual harms occur that are most closely associated with human trafficking, such as physical, psychological abuse, threat of punishment to work under substandard conditions, excessive working hours, exposure to occupational hazards, etc. And integration or reintegration would be when an individual is no longer in exploitative circumstances and is able to effectively participate in the economic, cultural, and political organization and life of either the country in which they were exploited or within their home country. So what we find is that this maps nicely onto the SEIR approach of thinking about conceptually, how could we subdivide populations of interest into the progression of how human trafficking occurs in reality. And of course, this is insufficient to describe the complexities of how human trafficking really occurs in reality on the ground, But for the purposes of modeling, you do have to find a counterbalance of what level of complexity are you looking at to make sure that it's perfectly representative of the phenomena in question, versus how do you weigh that against what data is available and what level of complexity is practical in order to deliver actionable information and useful insights. So now that we have a knowledge base in our conceptual approach, we need a specific geographic and sectoral focus where we look for data points that populate our mathematical model in order to run a simulation. So forced labor within the manufacturing industry comprises roughly 15% of cases worldwide of forced labor, and the Asia Pacific region has 64% of the total of these cases, representing a disproportionate number. So we further narrowed our focus within this geographic region to the city of Macau, which is in Thailand and right along the border with Myanmar. So it's a special economic zone, giving it preferential status for economic investment. And because of the number of oftentimes very vulnerable migrants coming across the border from Myanmar, it's become a hub of garment manufacturing that's notorious for cases of trafficking amongst these Burmese migrants that make up the majority of the workforce in the garment factories themselves right over the border. So because of high-profile cases linked to global supply chains of companies such as Starbucks and Bauer, there's been a lot of interest of international organizations, the Thai government, non-governmental organizations, and there's a lot of availability of data on the types of information that we would need to populate a mathematical model, such as migration patterns, border crossings, exposure to anti-trafficking awareness campaigns, and labor inspections, and so forth. So it provides an ideal geographic and sectoral focus in order to conduct a case study as we further develop our model. So our next step would be exploring the possibility of a preliminary mathematical model similar to the SEIR to describe the system based upon specific policy questions that we're seeking to answer. And what we're likely to find is that the information we've already collected, because of the associated challenges of data collection on human trafficking, it's likely to be insufficient to draw any type of explicit information and provide recommendations to policymakers. So we need to consult with data science and modeling experts to identify these gaps in data and how to account for them, either through the use of proxy measures or other types of mathematical approaches to account for the complexity and gaps within the data that is available in order to overall refine our model. And then from there, we need to consult with stakeholders on the ground in this context for a feasibility analysis of what would be the associated challenges of operationalizing something like this because of this nature between model development and implementation in practice. There's considerations that have to be taken into account related to changing practices of data collection, changing mandates of data sharing between different stakeholders, and much more has to be understood about the ecosystem in which this could potentially be applied in order to understand where it could be most strategically operationalized for its greatest potential impact. So some thoughts to wrap up is that classic epidemiological models have been previously used to analyze such complex and unique behavioral and social phenomena that have nothing to do with infectious disease, but rely on these same types of underlying principles. So we wouldn't be the first researchers to look at something like this. And particularly because human trafficking is both a global public health concern and prioritized within the SDGs, an epidemiological approach is of particular relevance because such types of novel methodologies are necessary to translate this complex social data surrounding the SDGs into policy recommendations so they can push forward progress to achieve the 2030 agenda. And here I have some references. And with that, I'm happy to answer any questions that you may have. Thank you.